My name is Fritzy Glover Sturmat, and I'm an pediatric occupational therapist here at Special Cheers. I'm the director and developer that has started the program here in 2002.
Now tell me just a little bit about this program. I know you've got horses, I can see all over the place.
Yes, we are a pediatric occupational therapy program that uses horses as one of our modalities of treatment here in Houston, Texas. We have 240-acre farm, provide different horses for different disabilities and different type of needs for all the children. We don't use traditional riding saddles. We use the natural rides from the Colorado Saddlery where they get full contact, they're bareback. And they're in full contact. The kids can hold on to the pommel, but otherwise they are in full contact with the horse. They feel themselves move along the way because they're actually looking into the environment, but the brain is calibrating their pelvic movements. The brain is integrating and learning how to make their pelvis move into normal patterning movements, such as normal walking gait patterns. So they are in space with the vestibular system, which is the neurological orientation in space, so they know how to move in space. Where the Quadriciser is in place movement, where the pelvis moves, the legs are moved, with the arms are moved, which is calibrating the brain to learn reciprocal patterning. So you need the reciprocal patterning along with the in-space neurological component of the vestibular system to make that gait pattern happen effectively, as quick as we get it to move it. This is Hunter, and Hunter is on Chief, and Hunter has cerebral palsy. Hunter's been riding for 13 years or so, and he is on his horse with the natural ride, and Hunter rides backwards for vestibular reasons. This is because he is in chronic extension, and the way his vestibular system, you see how he goes into extension as soon as we stop, he pushes all the way backwards. So we want to facilitate and have him to engage in flexion with his hips in motion so he can stay actually in the seating system. Right, and he goes to the Quadriciser after he does the horseback. So once he has gone into flexion and it really relaxes some of the vestibular tone, then we're able to get the muscle tone to relax down. And then he gets more reciprocal patterning, and he is able to become more engaged within both hemispheres.
Hunter was born 13 and a half years ago, and he was born 15 weeks early. Because this is something he can't do without the Quadriciser doing the work for him. He's too big right now for me to do legs and somebody to do arms. There's too much strength, and there's just no other way to get all four limbs cross-patterning for a child this tone and this size. So this is just the most perfect thing for Hunter to be in.
Good job. As far as Hunter, he would use only one hand to play with and reach for items, and Lori has reported that he's using both hands now. So between the left and right brain connection, he's starting to use more of his limbs. I've seen appetites change, speech, it affects the speech as far as neurological connections. And then physically also, just decreased tone, increased range of motion in upper and lower extremities. Yes, sir.
Great job, buddy.
And you can tell, when we started, those were rock hard, just as strong. Remember, Andy, we were rubbing the other side to kind of relax his arms. Now they're all mushy. And that's been 15 minutes. Like I said, I mean, the cross patterning, there's no other way. I've got a crawler that he can crawl, he can't crawl on it, but put him in it. But it takes 4 people, one to do each leg, each arm, and I don't have that manpower.
I know, it takes the whole neighborhood.
Yeah. It really does, and this has just been phenomenal. There's no, he is in a total, all these muscles are relaxed, and normally this is a boy who just throws in sharp tone.
And look at him, he's happy camper.
And totally relaxed, yeah.
Speech therapists say that they like to put their clients on a Quadriciser while they're teaching speech.
Absolutely, because it's cross-hemispheric, and so they're working both sides at the same time. As they're using their right arm, their left brain is engaging as they're their left arm, their right brain is engaging. So that motor pattern is kicked in because the right arm goes to the left brain. It's motor patterned right up there between the temporal parietal lobes. So as long as you've got that engaging, it's going to connect into the temporal aspect right behind the ear where the Broca's area is and where the Wernicke's area kicks in. Because you're getting the brain motor engagement, so the language can facilitate in. It connects those loops much faster. The hemispheres of the brain are so individualized. You have the right brain, which is melodic and rhythm, and your melody. So a lot of our kids on the spectrum do a lot of singing. They understand singing for transitions and singing to do things because that Broca and Wernicke's area have not connected for understanding and processing because that left brain is not engaged where in its higher level processing. It's higher level processing on that left side. Your left-sided people are fairly intelligent, more organized in their box-like type of things, okay, because it takes higher logical processing. If you look at Maltillus, y'all over the age to know Maltillus, he could sing, but he stuttered. There was a glitch in the Broca's and Wernicke's area to get out his speech and language, but he never stuttered when he sang.